So there'll be some duplicate information. I'm Joe Novick from the University of Minnesota. Good to see you guys again. So we're going to be talking about MS2 education. We kind of took the assumption that most medical schools teach a large burden of pathology and physiology during their MS2 year. So when we went through the assessment of problems and general needs, we divided it primarily as like resource, from a resource standpoint. So both like a cognitive and as well as a physical one. So buy-in, so as a resource, or needing buy-in from the first and second year course directors as well as from other relevant leadership. Top-down as well as the bottom-down approach, so kind of working on our champions from the top, but also integrating kind of the learners, so the medical students themselves, either through ultrasound interest groups or other mechanisms. And then developing a critical number of interdepartmental and interprofessional faculty as a resource, integrating, developing space within the MS2 curriculum was something we need. And then, of course, problems of lack of ultrasound machines, simulation equipment, and administrative resources that would be needed for implementation. So the needs assessment of targeted learners. So in thinking what we wanted the learners to get out of that year, wanted to expose the students to sonographic pathology, ideally live, that would be a goal. Understanding ultrasound apps, how ultrasound applies to pathology in clinical practice, and helping the student appreciate issues related to systems and costs and how that is relevant with ultrasound. And again, that interdepartmental and interprofessional nature and influence of ultrasound in medicine. And then prepare students for a competitive application environment for residencies. So we were considering that as something that we would want to achieve in the MS2 year, but that's also probably more of a global perspective. Goals and specific measurable objectives. Wanted to evaluate the role and limitation of ultrasound in diagnosis of disease, kind of like our umbrella goal, with the objectives of image acquisition and interpretation of common pathologic processes, recognition of ultrasound's role as part of this comprehensive evaluation, and evaluate images and recognize the need for consultation and further eval, so kind of have them also aware of the knowledge gaps that are created or that exist that ultrasound does not necessarily fill but might identify. Educational strategies to accomplish those goals and objectives. So e-learning resources like mentioned before and everything we talked about today, image libraries, peer-to-peer, faculty-to-peer, and everything in between, simulators, self-directed learning exercises, example being taking an ultrasound home with you or just living on your own. Research, outreach, and global experiences to enhance pathology. Other electives that might exist, and addressing competencies. We're thinking about addressing these competencies based on an LCME standard. We had a lot of deans in our group, which was really helpful in terms of kind of strategizing how to make a cell, essentially. So there's a whole new language I need to learn that I didn't realize. Implementation. So developing a pathway for development and utilization of these trainers that we identified before. How do you grow them, essentially? How to use them, how to keep them. And then also standardizing a patient supply. So is that a standardized patient? Can you develop a queue of patients with pathology? I think that would be an ideal, but certainly difficult to do. Commitment of resources from the medical school, but potentially also involving other institutional bodies to share that burden, like if there's an umbrella organization like an academic health center that might be involved with nursing education, other schools that could share the burden of cost and also utilize the machines. The hospital itself that might be able to make a purchase for faculty, for faculty education that could be used for medical student education. Content development or borrowing quality-free content once identified. Developing programs to train faculty. And then curriculum coordination and administrator assignments. Evaluation and feedback of our program. We're thinking about obviously development assessment tools. Some of what we've seen, but most of them will be need to custom tailor for every year and be a little different for every medical school. OSCEs, pre-post evaluation, multiple choice methodologies or other Suggestions were made for perhaps a mid-training feedback opportunity, because that might differ from an evaluation towards the end. Portfolio, peer-to-peer, like social media style evaluations, and then maybe an overarching M&E program of goals and objectives for year 1 through year 4, the overall goals, and as well as some sort of measure of the impact on residency education and residency experience. I think that's it.